Hi, so in this video I want to talk about my experience taking citalopram. So quick background is that I've been suffering on and off of depression for many years. And I, as of, let's say, during much of the past 3 months or so, I'd gotten into a phase where I was having really negative thoughts and feeling really depressed on an almost daily basis, having thoughts that are so negative, like borderline suicidal. So um, I decided to give something a try, and I started taking citalopram specifically because I knew somebody who had recommended it to me because they work with a doctor who's prescribed it, who's had a lot of success more than with any other drug, seeing results with their patients. So I thought, let's give that a try. And I tried other antidepressants in the past, like Prozac, and frankly hadn't seen results. But I thought let's just try this since she told me that the citalopram seems most effective, and I hadn't tried it before. And thankfully, I just happen to live in an area where I can actually buy it off the shelf, and so I did. I started taking 20 milligrams as of 3 weeks ago, and frankly, I'm like absolutely shocked with the results. I don't. I've definitely noticed a clear difference. Number one, yes, I do have negative thoughts, but they are not as painful as before. And number two, when I do have negative thoughts, I don't ruminate on them for as long. So I don't keep just obsessing for a long time. They kind of dissipate quickly. And now it's been about 3 weeks, and so far so good. Knock on wood. I don't know if I'm just lucky, or this is just a short phase, or what. But I have to say I'm very thankful for this, and I mean, definitely makes me want to recommend taking citalopram, or at the very least, recommend that you don't give up if you're struggling with depression, and you just keep on trying different drugs and seeing what happens. Um, the one thing I guess I should comment in terms of side effects, though, potential side effects. One is it does make it harder to orgasm. I mean, for me, especially during the first 10 days or so, practically impossible. After that, it became possible, but definitely still more difficult than before. That is an effect. Um, uh, that's the one definite effect I can point to. There are other things I'm not really sure about, whether they're side effects or not, but that's definitely at least an effect that I've noticed, side effect, which I think is quite common. Having said that, frankly, it's just that I guess if I just compare, if I have to choose between um, me feeling like super depressed, having thoughts bordering on suicidal, um, and being able to orgasm without too much difficulty versus feeling better and not depressed, um, but a lot of difficulty orgasming, I'll still take the latter. So, I mean, that's sort of, you might have to make that sort of decision if you do have some success.